टॉपिक शुरुआत करते हैं कार्डियोमायोपैथी। पहले नाम देखो, द नेम इज कार्डियो, हार्ट, मसल एंड मसल एबनॉर्मलिटी। हार्ट के मसल में कुछ एबनॉर्मल है एंड हेंस द नेम इज कार्डियोमायोपैथी, हार्ट मसल डिजीज। ओके, सो देयरफॉर बाय डेफिनेशन इट इज अ ग्रुप ऑफ myocardial disease associated with mechanical, okay, with mechanical और इलेक्ट्रिकल, या तो मैकेनिकल होगा, पंपिंग नहीं हो रही है, या इलेक्ट्रिकल होगा, ट्रांसफर नहीं हो रहा ठीक से, ओके, इलेक्ट्रिकल डिसफंक्शन, डिसफंक्शन, ओके, एंड उससे हो गया कॉजिंग कॉजिंग मेनली वेंट्रिकल हाइपरट्रॉफी और डायलेटेशन, कॉजिंग ventricular causing ventricular dilation, ventricular dilatation और hypertrophy, ventricular dilatation और hypertrophy, ठीक है। यूजुअली जेनेटिकल कॉज, यूजुअली इट इज ड्यू टू जेनेटिकल कॉज, मतलब जीन्स आर एबनॉर्मल हियर। तो पहले समझते हैं कि एक लिखा क्या हुआ है। पहले देखो, इट्स अ मसल डिजीज, याद रखना, इट्स अ मायोकार्डियल मसल डिजीज पहला। सेकेंडली, मैकेनिकल और इलेक्ट्रिकल प्रॉब्लम है, या तो पंप नहीं कर रहा ठीक से, या फिर ट्रांसमिट नहीं कर रहा इलेक्ट्रिकल सिंबल्स ठीक से, कॉजिंग आइदर वेंट्रिकुलर डायलेटेशन और हाइपरट्रॉफी। अच्छा, इट इज ऑफ टू टाइप्स, बेसिकली टू टाइप्स का मतलब है इट कैन बी प्राइमरी और सेकेंडरी, ओके, क्लासिफिकेशन वाइज इट कैन बी प्राइमरी or can be secondary. Primary is due to genetical or acquired disease of the heart, okay, मतलब heart disorder है, and secondary is due to systemic disorders, okay, अच्छा, now the types of cardiomyopathy, types of the cardiomyopathy, so sorry, types of cardiomyopathy, the three types, dilated cardiomyopathy, so it is DCM. If you call cardiomyopathy as CM, then DCM, okay. Second is hypertrophic cardiomyopathy, hypertrophic, so HCM. Some books call this hypertrophic obstructive, so it is HOCM, hypertrophic obstructive, okay, hypertrophic obstructive, so HOCM, and can be restrictive, so RCM, the three types of the cardiomyopathy, to begin this entire story हम शुरुआत करेंगे फ्रॉम द dilated cardiomyopathy. Let's start with the dilated type of cardiomyopathy. तो अब देखो, what is this dilated cardiomyopathy? ऐसा नाम से लग रहा है कि the entire heart muscle will dilate, तो heart muscle dilate क्यों करेगा? That's very important to think to understand. To understand this, I'll show you some images. देखो, so look at this basic heart muscle, and heart muscle में we must be able to understand that this is a contractile element, जहां पर this is a myosin, एक्टिन है, ओके, ये एक्टिन है, ओके, ये एक्टिन है ना, और ये जो दिख रहा है ये मायोसिन है, एंड दीज टू आर जॉइनिंग टुगेदर, एक्टिन है और मायोसिन है, दिस इज अ जेड लाइन, और जेड लाइन को जोड़ा हुआ है किससे? बाय टाइटिन, ओके, अच्छा, अब ये देखो, ये है मायोसिन बाइंडिंग प्रोटीन सी, now this and this z line is the midpoint of the actin, and two z lines are joined by titin, titin, okay, अच्छा, अब ये है मायोसिन और ये है एक्टिन, these two will combine together by myosin light chain जो कि myosin से निकल रहा है, एंड जो एक्टिन में लगा हुआ है ट्रोपोनिन एंड ट्रोपोमायोसिन, ट्रोपोनिन एंड ट्रोपोमायोसिन, ट्रोपोनिन है और ट्रोपोमायोसिन है। यहां पर देखो ये है मायोसिन हेवी चेन और मायोसिन लाइट चेन, बोथ ऑफ देम इंटरेक्ट विद द एक्टिन मॉलिक्यूल्स, बोथ ऑफ देम इंटरेक्ट विद द एक्टिन मॉलिक्यूल्स। अच्छा, अब मान लो किसी कारण से टाइटन इज नॉट देयर, तो एक्चुअली स्पीकिंग द टू जेड लाइंस आर ब्रॉट टुगेदर, ऐसे पास आते हैं, क्यों? बिकॉज ऑफ टाइटन। अब टाइटन ही नहीं है, दे विल गो अपार्ट। दैट इज द बिगेस्ट कॉज ऑफ द डायलेटेड cardiomyopathy, that's the biggest cause of dilated cardiomyopathy. So ultimately because of that, what happens, the heart muscle, it dilates like this, aisa, the heart muscle dilates like this. Look at the huge chamber of the heart, this huge chamber of the heart. Now if you take a biopsy on this, the heart muscles are these, और बीच में दिख रहा है ये वाला blue वाला, they all are the collagen fibers, they all are the collagen fibers. So ultimately in the dilated cardiomyopathy what happens, heart का पूरा का जो मसल है वो डायलेट हो गया, and between those so called heart muscles there is a collagen deposition, there's a collagen deposition. This whole thing is called as dilated cardiomyopathy. Let's see and write few details of this. देखो, पहला है TCM, dilated cardiomyopathy. So this is a morphological and functionally shown by a progressive, they show progressive cardiac dilation, समझो बात को, cardiac dilatation, and secondly very important, contractile dysfunction, contractile dysfunction, along with mild amount of hypertrophy, along with mild amount of hypertrophy. तो अगर कॉन्ट्रैक्टाइल नहीं कर पा रहा है तो मसल हल्के ऊपर डायलेट हो जाए, ये हाइपरट्रॉफी कर जाएंगे, just to come out of that issue. The basic etiology around 60% cases, 50% cases are due to number one, titin gene mutation. Titin gene mutation, the basic cause of this is titin. So TTN is the gene name which codes for the protein titin, so most commonly it is due to the titin gene mutation. Okay, a second cause of this is when the mitochondria they do not allow ATP to transfer, ठीक है, ATP to transfer. So the second cause often is because of the mitochondrial issues. Okay, it is due to mitochondrial gene mutations, especially in those enzymes which codes for the beta oxidation. So beta oxidation gene, those are mainly defective, those are the main defect here. इसके अलावा it can occur because of myocarditis क्यों होगा? Because of Coxsackie-B infection. Very important MCQ for you, Coxsackie-B infection. It can occur because of alcoholism. Alcohol is a toxin which can damage this, so alcoholism can be one of the cause, and surely it can be idiopathic. It can also occur postpartum, childbirth के बाद. Okay, postpartum, after the childbirth it can be seen. It can occur because of iron overload. Okay, it can occur because of the iron overload. So one of the reason is a hemochromatosis, that is one of the reason. और एक है supra physiological stress, supra physiological stress. Now this is often referred to as Takotsubo cardiomyopathy. इसका बस नाम याद कर लो, we have already spoken about this later on. So Takotsubo cardiomyopathy, ठीक है, इसे इमोशनल स्ट्रेस भी कहते हैं. सो काफी बार इमोशन इतना ज्यादा होता है कि दोस कैटेकोलामिन रिलीजिंग इट जस्ट कॉन्ट्रैक्ट्स द हार्ट, इतना जोर से कॉन्ट्रैक्ट, फोर्सफुल कॉन्ट्रैक्शन करता है, एंड हार्ट इज नॉट एबल टू गेट अमाउंट ऑफ ब्लड. तो कॉन्ट्रैक्शन हुआ, ब्लड नहीं पहुंचा, इट विल डायलेट. ओके, इट विल डायलेट. ठीक है, So as I told you, what happens in this DCM is that the patient often have the hypertrophied heart with a small amount of dilatation also. Dilatation भी है, hypertrophied भी है, and बीच में there is a collagen network. बीच में there is a collagen network. So that is very important in a heart. Remember, there is a variable size myocytes with interstitial fibrosis. With the interstitial fibrosis. Okay, with the interstitial fibrosis. Two things. Okay. So in the microscopy of the heart, there is variable sized myocardium, and इसके साथ there is a fibrosis, small amount of fibrosis, interstitial fibrosis can be there. ठीक है, interstitial fibrosis it can be there. ठीक है. A very unique thing often seen here is called as ninja stars. बड़ा unique होता है. तो ninja stars nothing but those findings which shows this the muscle. मतलब अगर मान लो ये heart muscle है, तो heart muscle shows this type of nuclei, ऐसे this type of typical nuclei. इसको नाम दिया गया ninja star nuclei. Ninja star nuclei. So heart muscle में a typical hyperchromatic nuclei is there. It is often due to the titan mutation. It is called as ninja star nuclei. Okay, ninja star nuclei कहते हैं इसको. Ninja star nuclei is called. The name is ninja star nuclei. ठीक है? It is about the dilated cardiomyopathy. नेक्स्ट पे चलते हैं. हाइपरट्रॉफिड. ओके, हाइपरट्रॉफिक cardiomyopathy. Okay, now this is again a clinical disorder where there is myocardial hypertrophy. पहला, there is a myocardial hypertrophy. There is a poorly compliant ventricle. मतलब वेंट्रिकल ठीक से फैलेगा नहीं, It is called as poorly compliant ventricle, and this leads to a diastolic failure. Why? Because during diastole the blood will not fill. Okay, so it will lead to less filling of blood during diastole, and hence we call this diastolic failure. Diastolic failure is a name given to this. Okay, and along with this, often it causes intermittent ventricular outflow obstruction. It causes intermittent, not always though, intermittent ventricular outflow obstruction. So 4 things: 1, 2, 3 and 4. 1, 2, 3 and 4. The 4 things are seen in the hypertrophic cardiomyopathy. ठीक है. अच्छा, अब इसका बेसिक कॉज जो है वो क्या है? द मोस्ट इंपॉर्टेंट etiology for this is the mutation. In about 100% cases occur because of mutation only. And mutation is the beta myosin heavy chain. Okay, beta MHC मतलब beta myosin heavy chain mutation is the most and the main cause of the hypertrophic cardiomyopathy. Main change is the beta myosin heavy chain. Okay, beta myosin heavy chain. So what happens because this is the beta myosin heavy chain से the energy transfer is not normal. मतलब देखो, बीटा मायोसिन हेवी चेन कहाँ था? ये अगर मान लो कि ये मायोसिन है एंड ये एक्टिन है, सो दीज टू बेसिकली, ये जेड लाइन था, दिस इज जेड लाइन हियर, राइट? रिमेंबर, अ बीटा मायोसिन हेवी चेन इज हियर समवेयर हियर, ऐसे, which is joining these two. So this is the beta myosin heavy chain. Because of the absence or mutation of the beta myosin heavy chain, होता क्या है कि द इंट्रैक्शन इज नॉट वेरी नॉर्मल, इंट्रैक्शन इज नॉट वेरी नॉर्मल, ठीक है, एंड देयरफॉर द एनर्जी ट्रांसफर फ्रॉम द माइटोकॉन्ड्रिया जहां से जनरेट हुआ एंड टू द यूज सार्कोमियर इज नॉट प्रॉपर. ओके, सो एनर्जी ट्रांसफर फ्रॉम द माइटोकॉन्ड्रिया मतलब कि सोर्स ऑफ जनरेशन जो कि सोर्स है, टू सार्कोमियर, सार्कोमियर मतलब एंड यूजर इज एबनॉर्मल, इट इज एबनॉर्मल, इट इज एबनॉर्मल, ठीक है, इट इज एबनॉर्मल. इसीलिए अल्टीमेटली द हार्ट इज नॉट एबल टू कॉन्ट्रैक्ट प्रॉपर्ली ऑल्सो. When it is not able to contract properly, ultimately the muscles they get hypertrophied. The muscles they get hypertrophied. So what happens? There's a massive myocardial hypertrophy without any dilation. So what happens? There's a disproportionate. मतलब क्या होगा? अगर मैं इसको इमेज बनाऊं, the heart muscle it will be looking like this ऐसे. Now this is the ventricle. अब septum will show you this hypertrophy ऐसा. The septum will show you this hypertrophy. ठीक है, this is what is left ventricle, right ventricle, और this is a valve ऐसे. So this is a septum, and look how septum hypertrophy कितना बड़ा हो गया septum. This huge amount of septal hypertrophy seen, huge amount of asymmetrical, it's called as asymmetrical, okay, asymmetrical septal hypertrophy is seen. तो septum is hypertrophying more than the ventricle. देख रहे हो, ये जो है ना, ये ब्लड वाला वेंट्रिकल है, ये वेंट्रिकल है जहां ब्लड भरा हुआ है, इधर से वेंट्रिकल ऐसे. Now this ventricle is now taking the shape of a fruit. किस फ्रूट की तरह दिख रहा है ये? Which fruit are you looking like? Which fruit? बताओ तो जरा, देख के कैसा लग रहा है फ्रूट, गेस करो एक. It is banana. It's a banana like configuration. It's a banana like configuration. Okay, banana like configuration. ठीक है. So this banana like configuration by the bulging of the ventricle septum also into the lumen. Okay, पूरा का ventricle septum it is compressing on the lumen. In the lumen, it is causing this banana like configuration. Banana like configuration. So ultimately, this will lead to left ventricular outflow. Outflow obstruction will lead to left ventricular outflow obstruction. ठीक है, mostly it happens because the mitral valve it actually touches the septum. Mitral valve it often touches the septum. ठीक है, ठीक है. So I'll write it, mitral valve it will actually touch the septum. Mitral valve actually it will come in contact, it comes in contact with the septum, and therefore there is a left ventricular outflow obstruction. Left ventricular outflow obstruction. ठीक है. अच्छा, clinically what happens? There is definitely a less amount of blood filling this will cause diastolic failure, will lead to diastolic failure. ठीक है, because of huge amount of the hypertrophy, the blood is not able to reach there, and hence will lead to coronary artery disease. Coronary artery disease. It can lead to the fibrillation, atrial fibrillation. It can lead to middle thrombus also. Cardiac failure can happen. Arrhythmias can happen. So a lot of these things can happen, and HCM is the most common cause of sudden death in a young athlete. Remember, clinically, it's the most common cause of sudden death in a young athlete. Okay, most common cause of sudden death in a young athlete. It is this one. Okay. A question was also asked कि if a patient who is young athlete he suddenly died, so what is the cause? So cause is surely obstruction, but even a more common cause than obstruction is basically the arrhythmia which can happen to this. So arrhythmia is often the main cause of sudden death. Arrhythmia is the main cause of the sudden death there. ठीक है? It causes the focal myocardial ischemia. Focal myocardial ischemia. ठीक है? And the main clinical problems would be the atrial fibrillation. Okay? And I told you कि जहाँ fibrillation होगा, there surely will be thrombosis. जहाँ thrombosis होगा, वहाँ पर embolism होगा. So thromboembolism episodes. It can lead to stroke also. It can lead to stroke also. And hence it can lead to sudden death. Can lead to sudden death. The murmur surely is ejection systolic murmur. Ejection systolic murmur is often seen in these cases. So what do you see in a image? Look at this one. Look at this banana-like configuration. Look at the huge hypertrophied septum. और ये देख रहे हो बिल्कुल पतला सा बन गया है. And look at the mitral valve coming on this, in this. So when this thing contracts, this even comes in contact with this one. So blood is not able to come out, and hence there's obstruction. So what is I'm trying to say? This is a septum, right? It's a mitral valve. So when this thing contracts, this whole thing is not able to push the blood out, and hence it causes obstruction of the blood flow. Look at the huge disc array, completely abnormally arranged myocardial fibers, disc array of the myocardial fibers, and the in this area, the middle area, here this area are all the collagen networks. They're all other collagen networks you see here. Collagen networks you all see here. Next is third one, restrictive cardiomyopathy. So we can call this RCM. We can call this as RCM. RCM is basically a decrease in the ventricular compliance. Okay, it's a decrease in the ventricular compliance. Decrease in the ventricular compliance, causing impaired ventricular diastolic filling. Causing impaired ventricular diastolic filling, and hence again it's a type of diastolic failure mainly. But because of that compliance समझते हो ना, ऐसे contraction relaxation, because of the reduced compliance, this also is a systolic failure also. The basic etiology which will not allow the heart muscle to contract properly would be a fibrosis in the myocardium. So what are the etiologies which can cause this? Number one, it can be amyloid, most commonly amyloidosis. Okay, it can mainly be amyloidosis, which is not allowing the heart muscle to contract properly. But apart from the amyloid, it can be some other causes, like it can be a lymphoma, it can be metastasis, it can be hemochromatosis, So all of these effects can happen along with radiational fibrosis. It can be sarcoidosis. ठीक है? So any cause of, suppose, inborn error of metabolism is there, causing deposition of metabolites. They can also lead to such issues where the ventricle will not contract or relax properly. Ventricle will not contract or it will relax properly. तो accordingly, जैसे कि जिस तरह का वो डिजीज होगा, उस तरह का वहां पर फाइंडिंग दिखेगा. जैसे मान लो कि अगर अमलाइडोसिस है तो क्या दिखना चाहिए? अमलाइड दिखना चाहिए. लिम्फोमा है तो लिम्फोसाइट्स के एग्रीगेट्स दिखेंगे. मेट्स है तो कोई पूरा न्यूप्लास्टिक सेल्स दिखने चाहिए. हेमोक्रोमैटोसिस है तो आयरन डिपोजिशन पर्ल स्ट्रेन से पॉजिटिव आएगा. फाइब्रोसिस है तो कोलाजन आएगा. साइक्रोसिस है तो ग्रानुलोमा दिखेगा. And inborn metabolism है तो that metabolic products will be seen inside the heart muscle. So based on the different etiologies, different findings will be seen, but the basic problem is the heart is not relaxing. The heart is not relaxing properly. the heart is not relaxing properly. So in a way, if you look at the basic cardiomyopathies, cardiomyopathy, it can be dilated, hypertrophied, restrictive. The main type of failure in dilated, it is systolic dysfunction, heart not contracting properly. In hypertrophied, the diastolic filling is abnormal. Restrictive also, diastolic filling is abnormal. Mainly in a hypertrophied, it is almost all cases are genetical, beta myosin heavy chain. In dilated, it is can be lot of causes, including the titin. It can be alcohol, can be pregnancy, can be iron overload, it can be drugs, it can be a lot of other failures like myocarditis can also be there. In restrictive, it can be mainly amyloidosis, but can be other causes like radiation injuries, sarcoidosis, it can be metastasis, it can be radiation fibrosis, it can be inborn metabolism deposition. So all of those can be seen in a case of kisme, in a restrictive कार्डियोमायोपैथी. ठीक है, तो कार्डियोमायोपैथी में क्या समझ में आया? हमें ये समझ में आया कि अगर मान लो कभी भी हार्ट मसल में वीकनेस है ड्यू टू जेनेटिकल और एक्वायर्ड कॉज, मैकेनिकल फेलियर और इलेक्ट्रिकल डिस्टर्बेंस, इट इज कॉल्ड एज कार्डियोमायोपैथी. 3 तरह के होते हैं, डायलेटेड, हाइपरट्रॉफिड एंड रेस्ट्रिक्टिव. क्या जानना है? सडन कार्डियक डेथ इज कॉज्ड बाय hypertrophied. Main cause में arrhythmia, but also due to obstruction. There are various questions being asked nowadays in the cardiomyopathies. Okay.